Hello guys, today we will talk about NSAIDs. NSAIDs stand for non-steroidal anti-inflammatory drugs. To understand NSAIDs more clearly, we should have a good idea about inflammation. What is inflammation and its mechanism? Inflammation is the body's response to the harmful stimulus, which can be due to some injury or the trauma. Mechanism of inflammation: it starts when our immune cells they lead to the phospholipase A2 plus the membranous phospholipids. They form the arachidonic acid. Then the arachidonic acid forms cyclooxygenase enzymes. The cyclooxygenase enzymes are divided into two, that is COX-1 and COX-2. COX-1 is the active form and COX-2 is the inactive form, and which gets activated when into action. So COX-1 and COX-2 both produce prostaglandin E2 and prostacyclin. Prostaglandin E2 can also be known as PGE2. Prostacyclin can also be known as PGI2. What are the functions of prostaglandin E2 and prostacyclin are? Vasodilation, attract the immune cells, act on neurons that detect pain, that is the nociceptors, and increase the sensitivity to the stimuli. It stimulates the hypothalamus, which results in the increase in the body temperature, leading to the fever. This was the mechanism of the inflammation. But there is only a specific task for PGE2, that is prostaglandin E2, that is uterine contraction and decreased secretion of the acid and increased production of the protective mucus. NSAIDs treat inflammation, pain and fever. These are the treatment for NSAIDs. But what happens in inflammation is it increases the production of prostaglandins, that they are the pro-inflammatory chemical substances. And NSAIDs, what it does, it decreases the production of the prostaglandins and leading to the decrease in inflammation, decrease in the pain and decrease in fever. For the types of NSAIDs can be divided into irreversible and reversible. Irreversible COX inhibitors are like aspirin, and reversible COX inhibitors are like non-aspirin NSAIDs. Again, reversible COX inhibitors can be again divided into non-selective and selective. We know the difference between non-selective and selective, but I'll tell you again, that is non-selective is when the drug works on both the substances. That is, here it works on both COX-1 as well as COX-2. It is not selecting any particular inhibitor. But selective is it works only on COX-2. That's why it is known as selective. So non-selective example is ibuprofen and selective can be celecoxib. Now starting with aspirin, what is it? Irreversibly inhibiting COX-1 and COX-2. It is taken orally and the absorption occurs in the ileum. Mostly, not all the time, but in most of the cases the absorption occurs in the ileum. Then it goes to the bloodstream. In bloodstream, it inhibits the COX-1, then decrease the production of the thromboxane A2, and hence aspirin can also be known as antiplatelet medication. When it goes to the liver, in the liver the aspirin get converted into salicylate, and there it inhibits COX-2. But here there is no antiplatelet effect, but there is presence of anti-inflammatory properties, and therefore it decreases the prostaglandin production, decreases the inflammation, pain and fever. So we saw the difference. When it is in bloodstream, it inhibits COX-1. When it is in liver, it inhibits COX-2. When it is in bloodstream, it has antiplatelet medication. When it's in liver, it has anti-inflammatory properties. Now, indication of aspirin. It can be used for headache, musculoskeletal pain and short-term treatment of the chronic pain. Effects. The effects of aspirin, they depend upon the dose. Like low doses of aspirin, that is less than 300 mg per day, has antiplatelet effect. The medium doses, that is 300 to 2400 mg per day, has antipyretic and analgesic effect. The high doses, that is more than 2400 mg per day, has anti-inflammatory effect. Baby aspirin or very low doses used for long term to prevent heart attacks, strokes and blood cholesterol formation. This is it is of 81 milligram, and it is known as baby aspirin because it is given in very low dose for a continuous term. Aspirin is contraindicated in gout as it competes with uric acid for excretion, so it may lead to the exacerbation of the gout. Therefore, it is contraindicated to be given in gout patients. The non-selective COX inhibitors. The non-selective COX inhibitors reversibly inhibits both COX-1 and COX-2 given orally. The name of the drugs are ibuprofen, naproxen, ketorolac, indomethacin, sunildac, and meloxicam. Among this, we use mostly ketorolac post-surgery. Here, as it is non-selective, so it inhibits both COX-1 and COX-2. When it inhibits the COX-1, it has antiplatelet effect. When it inhibits COX-2, it has anti-inflammatory effect, same as the aspirin. Indications are also same as aspirin. Here, ibuprofen, naproxen, and indomethacin, they decrease the inflammation during acute gout attack. Therefore, these three are indicated in gout patient. Selective COX-2 inhibitors are reversibly inhibiting only COX-2. In the name only it's written selective COX-2. It inhibits only COX-2. Example is celecoxib, inhibiting only COX-2. It does not inhibit COX-1. We have to remember it very carefully that selective COX-2 inhibits only COX-2, not related to COX-1. Indication is treatment of the pain and inflammation. Side effects can be stomach problems like gastritis and bleeding, kidney damage, hypertension, aspirin overdose. Aspirin overdose can lead to hearing problems, respiratory alkalosis, metabolic acidosis, and coma. Hypersensitivity reactions. There is a triad which shows us how the hypersensitivity reactions take place. The triad's name is Samter's triad. Here in one end, that is asthma, nasal polyps, and NSAID hypersensitivity. The Samter's triad is the aspirin exacerbated respiratory disease. This is a triad, very important and most commonly asked in competitive exams. So we should remember the triad consists of asthma, nasal polyps, and NSAID hypersensitivity. So I know NSAID is a tough topic and it's little confusing also. Therefore, I will clear it again for you. NSAID, the types of NSAIDs are mainly into two, that is reversible and irreversible. Irreversible, that is aspirin, and reversible, that is non-selective and selective. Non-selective, that is ibuprofen, and selective, that can be celecoxib. There are more drugs, but mainly ibuprofen and mainly celecoxib for selective drugs. I hope it helped you in understanding the mechanism of inflammation, NSAIDs, and types of NSAIDs, and indication, effects, side effects, contraindications. Thank you.